Imagine this. You are suddenly feeling unwell and you need medical attention. In one country, you walk into a clinic, get checked out, and walk out without ever reaching for your wallet. In another, you hesitate, thinking about the bills, insurance, and the aftermath of that visit. Can you guess which countries I'm talking about? If you read the title, you probably can. But before we dive into the differences of the American and the Danish healthcare settings, let me just say, hey there everyone, I'm Martin, a Bachelor of Science in Nursing and a proud clinical nurse educator. I've had the privilege of diving deep into the intricacies of healthcare, and today I want to take you on a journey comparing the Danish healthcare system to its American counterpart. Before we dive in, a little disclaimer. The insights I'm about to share are based on my professional experiences and observations. Healthcare is a vast and complex field, and while I am aiming to provide a comprehensive comparison, remember that individuals' experiences can vary. And let's start by putting all of this into some historical perspectives. To truly understand the healthcare landscape of Denmark and the United States of America, we need to journey back in time, starting with my home country of Denmark. The foundation of our modern healthcare system lies with the opening of the first Danish hospital back in 1751. The Danish healthcare system has always been driven by a commitment to universal access. By the 1970s, this vision had fully materialized with the establishment of a tax-funded system ensuring healthcare was a right, not a privilege. Over the years, several milestones have solidified Denmark's commitment to health. The focus shifted from just treating illnesses to preventing it, leading to some robust public healthcare initiatives and an emphasis on primary care. But across the pond, over in the American healthcare system, the story is a tapestry of both public and private endeavors. The early 20th century saw the rise of employee-sponsored healthcare insurances, setting the stage for a system heavily reliant on private insurers. The mid-20th century introduced Medicare and Medicaid, government-run programs aiming to cover the elderly and the economically disadvantaged. Throughout its history, the American system has grappled with striking a balance between private enterprises and public welfare. Landmark legislations like the Affordable Care Act in 2010 aimed to expand coverage, yet millions still navigate a maze of insurance networks, premiums, and out-of-pocket expenses. Both systems, while rooted in their unique histories and societal values, have evolved over the years, striving to serve their populations in the best way possible. But how do they fare today, especially when it comes to cost and accessibility? Let's delve a little bit deeper into that. Let's talk about the engine that powers these healthcare systems: funding. How do Denmark and the USA finance their healthcare, and what does it mean for their citizens? That is the question we have to ask. So, let's start by looking into Denmark. Our healthcare is predominantly tax-funded. When Danes pay their taxes, a significant portion of that money is earmarked for healthcare. This system ensures that healthcare is universally accessible and, for most service, free at the point of delivery. It is worth noting that while the Danes pay a high tax rate, it's a reflection of our societal values in collective welfare. These taxes support a wide range of services, from hospitals to general practitioners, ensuring that everyone, regardless of their economic status, has access to quality care. Whereas the USA, on the other hand, has a more complex tapestry of healthcare funding. While there is government involvement, especially for specific populations like the elderly and low-income groups, a significant chunk of American healthcare is financed through private insurance. Many Americans receive healthcare insurance through their employers who are paying a monthly premium to maintain their coverage. However, this insurance model often comes with copays, deductibles, and other out-of-pocket expenses, making healthcare access a financial consideration for many. To support those who might not afford private insurance, the US government introduced Medicare for the elderly and Medicaid for the economically disadvantaged. While these programs have significantly expanded coverage, navigating the American healthcare funding landscape can still be challenging for many. So let's look at it from a bird's eye view. Denmark opts for a collective tax-funded approach, emphasizing universal access. The USA, with its blend of private and public funding, presents a mosaic of coverage options, each with its own set of advantages and challenges. So what does that mean for the patient? That is what we're going to be tackling next. While healthcare funding is just one piece of the puzzle, another crucial aspect is how easily patients can access care when they need it. Let's explore the landscape of Denmark and the US in this regard. In Denmark, we take pride in accessibility of our healthcare system. Most residents have easy access to primary care services, whether you need to consult with a general practitioner, get a routine checkup, or require specialized care. We have the pathway streamlined. And if you want me to dive much more into how to get good quality care in Denmark, then write it down in the comments and I will make an entire video about it. One of the pillars of our system is the centralized electronic health record. This digital infrastructure ensures that no matter where you seek care in Denmark, your medical history is accessible, reducing administrative hurdles and ensuring continuation of care. For specialized services, the referral system plays a pivotal role. Your primary care provider can seamlessly refer you to specialists, ensuring that the right expertise is tapped into for your specific needs. The American narrative is a bit more nuanced. Access to healthcare can vary significantly based on one's insurance coverage. Being in-network or out-of-network can dictate where you receive care and at what cost. Geography also plays a role. While urban areas might boast state-of-the-art facilities and abundance of specialists, rural regions can sometimes face challenges, with residents needing to travel considerable distances for certain services. And then there is the matter of wait times. For non-emergency procedures or specialist consultations, the wait can sometimes be lengthy, requiring patients to plan well in advance. While Denmark offers a more homogenized and streamlined access to care, the American system presents a spectrum of experiences influenced by insurances, locations, and individual circumstances. But what does this mean in terms of cost? Let's delve into that next. Money talks, especially when it comes to healthcare. So how do Denmark and the USA stack up in terms of healthcare cost? Let's dive into the numbers. In Denmark, the principle is simple. Healthcare is a right, not a privilege. Because our system is predominantly tax-funded, most healthcare services comes at no direct cost to the patient at point of delivery. While some services might have a small copay, the majority are entirely free, even when it comes to medication. There are subsidies in place to ensure affordability. The idea is to reduce financial barriers, making healthcare accessible to all, regardless of one's economic standing. The American healthcare landscape paints a different picture. The cost of medical services can vary widely based on insurance coverage, location, and specific services required. For instance, a routine doctor's visit, a surgical procedure, or even a prescription can come with significantly different price tags depending on numerous factors. And while insurance might cover a portion, out-of-pocket expenses can sometimes be substantial. One area where costs are notably higher in the USA is prescription drugs. The tug of war between pharmaceutical companies, insurance providers, and legislation has led to some medications having exorbitant price tag. In essence, while Denmark offers a largely uniform and transparent cost structure, the American system presents a mosaic of cost influenced by a myriad of factors. It's a dynamic interplay of policy, market focuses, and societal values. But how does this cost translate into patient experiences? Well, let's try to look at that. If we go beyond the numbers and policies, healthcare is about people. It's about you and me, our families, and our communities. So what is it like to be a patient in Denmark and in the USA? In Denmark, patient satisfaction is generally high. The system's design, which emphasizes universal access and minimized direct cost, fosters trust. The patients feel cared for, knowing that their well-being is a shared social priority. Another hallmark of the Danish system is the continuity of care. Patients often have long-standing relationships with their primary care providers. This fosters a sense of familiarity and trust, ensuring that the care received is not just medically sound but also personalized. The USA, given its vast and varied landscape, presents a spectrum of patient experiences. While some receive world-class care and have positive interactions, others face challenges navigating intricacies of the system. Insurance coverage, location, and even individual healthcare providers can influence a patient's journey. In some cases, patients become advocates for their own care, learning to navigate the maze of insurance networks, coverage limitations, and referral processes. At its core, both systems aim to provide the best possible care to their populations. While Denmark offers a more homogenized experience rooted in societal values of collective welfare, the American system, with its blend of private and public elements, presents a diverse experience shaped by a multitude of factors. But how do these systems impact the very people who deliver this care, the nurses and healthcare providers? I want to take a look at that. Nurses are the beating heart of any healthcare system. Our role often extends beyond clinical care to being the patient's advocate, educators, and pillars of support. So how do nurses in Denmark and the USA perceive their roles and the system they work within? In Denmark, the nursing profession is deeply integrated into a holistic healthcare model. Our emphasis on primary care and prevention means that nurses often take on the role as educators and community health advocates. We are not just treating illness, we are actively involved in promoting well-being. The Danish system, with its streamlined pathways and emphasis on continuity of care, allows nurses to build meaningful relationships with patients. This bond is not just therapeutic but also ensures that care is tailored to the individual's needs. American nurses navigate a different terrain. Given the vastness and variability of the healthcare system, nurses often find themselves at the crossroad of clinical care and administrative complexities. From ensuring that care aligns with the insurance stipulations to advocating for patients in a system that can sometimes feel overwhelming, the role of an American nurse is multifaceted. Despite the challenges, American nurses are renowned for their resilience and adaptability. They are trained to excel in diverse environments, from the state-of-the-art urban facilities to resource-limited rural clinics. The spirit of advocacy and patient-centered care is deeply integrated into the professional ethos. Whether in Denmark or the USA, the essence of nursing remains constant, a commitment to care, compassion, and community. While the landscape differs, the dedication to improving patient lives is a shared thread that binds the nurses community globally. And fun little side note, the hourly rate before taxes in the US versus Denmark, well, the nurses over in the United States of America earns a bit more than the Danish nurses, according to general statistics. It is not much, but it is actually a bit more. And if you want to know more about what it is like to work in the Danish healthcare system, then check out this video right here where I talk about my day as a nurse in an intensive psychiatric unit. Check it out right there.